Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, one on one sessions, and more to assist nurses as well as nurse practitioners with exam success. Now, I've been doing this since 2015, assisting nurses and nurse practitioners internationally. I always like to give my disclaimer before getting started because we know there's no absolute in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have created and designed based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of the videos that I do that I may teach on things that we currently do in practice, I will always say that so there's no confusion. So, that being said, let's get into our questions for today. Also, you guys, if you haven't had a chance and you're looking to do extra questions with me, I have opened up my membership. It's $9.99 a month, where you will be able to get weekly additional questions. We launched our first video on yesterday, so check it out if you need more practice. All right, question number one. A 76-year-old female returns to the office for follow up today. The nurse practitioner diagnosed the patient with hypothyroidism and is initiating treatment. What is the best treatment option for this patient at this time? Is it A, Tapazole 25 milligrams PO daily, B, Synthroid 25 micrograms PO daily, C, Tapazole 50 milligrams PO daily, or D, Synthroid 12.5 micrograms PO daily? Take a moment and tell me what you got in the comments. All right, you guys. So, I always recommend reading the stem of the question first because it allows you to slow down to ensure you're answering what is even being asked of you. So, here the stem of the question states, what is the best treatment option for this patient at this time? All right. So, I always say if it's asking about treatments, you need to run it back and see what the diagnosis is. See if they have provided you a diagnosis. And if they have not, then you need to take a step further and look at the assessment findings so that you can come up with the diagnosis, right? We're always processing and working through all of the differentials to be able to see what the potentials are, rule out, and treat. So here they have already told us that the patient has been diagnosed with hypothyroidism. So we're looking for the best treatment option. So we know first line therapy for hypothyroidism is Synthroid, right? And we typically start with our Synthroid 25 micrograms PO daily. I always tell you that's it. For testing purposes, we start there. We start low and we start slow. If they ask you, because you think of it like it's the perfect world for tests, right? They're just trying to make sure that you know what you do. In practice, I know y'all, I know that we do things a little bit different. It's based on the patient's numbers, etc. On boards, you need to know when to initiate Synthroid. So TSH 10 and greater, you're starting the medication. And so we're here. So we want to start this Synthroid. We want to start low and slow, but look at this patient's age. And I had somebody in one of my one-on-one sessions a couple of weeks ago who mentioned and said, yeah, I always see like the ages, the race, and I just continue through, but I want to make sure, they're leaving it out. They were stating that they look at this in a fashion of just information. It's just there, it's fluff. And I'm like, no, this is how we work of our patient. These are things that we consider when the person is in front of us, right? So they're giving you all of the details just as you would in your HMP here in the question for specific purposes. You need to consider all of these things. Their If they're a male or female plays a role. What their ethnicity is plays a role in some things. Their age plays a role. Pay attention to those things. Y'all know I just did a short, I was talking about something and I said, pay attention to the details. Those little details are key. This can be the very thing that helps you get the answer correct or incorrect, right? Which in this case it does. This patient is 76 years old. This is an elderly patient. You want to start elderly population with their Synthroid at 12.5 micrograms PO daily. We really move low and slow in the elderly population. They metabolize slower, all of the things. It's 12.5 for the elderly. If you rush through, skim past, didn't pay attention to the details, you would have gotten this incorrect. So make sure you pay attention to everything that is provided to you in the question. All right, so the best answer here is D, Synthroid 12.5 micrograms PO daily. All right, question number 2. The nurse practitioner is discussing a chronic autoimmune disorder related to the cause of hypothyroidism. What disorder are they discussing? Is it A, Graves' disease, B, thyroid storm, C, Hashimoto's disease, or D, parathyroidism? Take a moment and tell me what you got, you guys. So here, the stem of the question states, what disorder are they discussing? All right, so here the nurse practitioner is explaining to the MP student about chronic autoimmune disorders related to the cause of hypothyroidism. So, what is this? When you think of an autoimmune disorder associated with hypothyroidism, you need to think of Hashimoto's. C, Hashimoto's disease. So, Hashimoto's is a chronic autoimmune disorder that causes the attack basically on that thyroid gland. So, you don't have enough production of that thyroid hormone, leading to hypothyroidism. And so, this is called Hashimoto's disease. Remember, Graves' disease is what? It's the opposite, right? It's the autoimmune disease associated with hyperthyroidism, right? So make sure you know your terms. Make sure you're not missing little pieces that they're including. And then question number 3, the nurse practitioner is explaining to the MP student when a patient has uncontrolled hyperthyroidism or it has gone untreated, this can lead to an emergency situation. She explains the patient may have associated tachycardia, fever, and hypertension. What diagnosis is the nurse practitioner explaining? Is it A, Graves' disease, B, thyroid storm, C, Hashimoto's disease, or D, parathyroidism? Take a moment and tell me what you got, you guys. All right, so here, stem of the question states, what diagnosis is the nurse practitioner explaining? So let's run it back and see what she's talking about. So the nurse practitioner is explaining to the MP student that when a patient has uncontrolled hyperthyroidism or this hyperthyroidism has gone untreated, so it's just elevated, it's the overproduction of that hormone without any control or balance or treatment to regulate the production of that thyroid hormone, right? This can lead to an emergency situation, right? Y'all know this. And so, this patient, if in fact they are in this emergency situation, emergency disorder phase, they may also have associated tachycardia, fever, and severely elevated hypertension. With this, you need to know that it's thyroid storm, B, a thyroid storm. Yes, Graves' disease is associated with a hyperthyroidism, but remember, it is the autoimmune disease that is triggering the overproduction of the hormone, right? Thyroid storm is when this thyroid, for whatever reason, the thyroid levels are elevated, hyperthyroidism, right? And it's uncontrolled. It hasn't been managed. It's untreated. It's not regulated. And when it continues to persist in this elevated state, it causes the body to have more emergent issues, such as those severe levels of hypertension, those severe high blood pressure levels. The tachycardia can be extremely elevated as well for your heart rate, fever, etc. So pay attention to those close details and know that they may be in a thyroid storm. Now, also, when I tell you to pay attention to the details of this, I design my questions for a reason. So this is more on a knowledge-based level because I'm trying to make sure that you have the foundational piece of this, right? Before I've asked it in a different fashion so you'll know how to apply it differently. Because the question may just tell you this patient has a history of hyperthyroidism. They may tell you the lab value and say that, it has remained elevated or whatever for this time period. The patient now, they may give you the vital signs, tachycardia, the heart rate 120 beats per minute, showing that they have a fever, showing the blood pressure 180s over 100s or something. I'm just saying stuff off the top of my head. But they may give you the presentation saying just this very thing to make sure that you know, hey, I need to consider that this is the thyroid storm and refer them out to the emergency room for further management because this can be a fatal situation. It's a life threatening condition. We need to refer them out. So I like to give it to you in various fashions so that you're able to gauge your knowledge, see where you are with that to get that foundational piece, and then build on it so that you're able to apply it. So when that you encounter various questions and patients, um, you're able to pivot from the way it's presented to you. Okay. So, all right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But make sure you meet me back here. If you need any of the resources that I offer, please feel free to reach out to the nursing studio. You can give us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Things that I offer are the review book. Review book is broken down by system. It includes images that are color in color so that you can see and visualize the topics that I'm explaining. I like to do charts with certain things so that you're able to grasp those. With each system, there's an interactive section to test your knowledge, broken down in that fashion that I talk about all the time: assessment, diagnosis, evaluation, and treatment. There's also practice questions at the end with rationales. You can get it in the ebook option or the paperback option. Both of those are linked in the bio of this channel. Next is the self-paced on-demand review course. It's designed for family and adult general review students preparing for either exam, ANCC and AAMP. It's a subscription base, so it's $89.99 per month, and you can end it at any time, but you're able to watch those videos over and over, broken down by system, mini quizzes, things of that nature, just so that you can make sure that you have that foundational knowledge. You know, I am big on eliminating the fluff, so I provide it in a short and sweet fashion just to kind of give you a quick review on the go. That's also linked in the bio of this channel. 5-week review. The next one, that's a group course, will be up in September. I do offer some individual 5-week review courses that you can just do it independently, and then we'll meet. But it is subject to how many people, because that's a group course, and I don't typically do it individually unless specifically requested, and I have the time allotted to give to you. So just reach out if that's something that you are needing. Um, and then lastly are the one-on-one sessions. You know, I do 3 different options. One is the weaknesses, so you can book a session to cover 1 to 2 areas that you're weak in. Or if you're looking for exam readiness assessment, I provide that. Now, my exam readiness is not just a questionnaire. It is broken down with pretest, system analysis. So each system, so it takes a little bit of time because I go through and provide you with a readiness evaluation independently on each area, so you know how to prepare with those. So my exam readiness is a little bit more detailed. So keep that in mind if that's something that you're looking for, so you can have the time to allot to do that. And then lastly is the custom plan with the one-on-one sessions. And again, I always say reach out so we can gauge what you truly need because it's designed specifically for you. So we do an initial pretest to gauge where you are. And based off of the time that you're looking to review, I design a structured study plan and work alongside with you during that time frame because we're working to be successful on boards as well as in practice. You know, I always say that, and that's what I truly mean and stand by. All right, you guys, that's my spiel. I hope you found this helpful. Y'all make sure y'all meet me back here. Happy studying. And for those of you who are joining me live Saturday for our virtual practice question course, you will be getting all of the details and links and everything on tomorrow. So be on the lookout. Make sure you're checking your emails. And I can't wait to work with you on Saturday. All right. Happy studying. Bye, y'all.